How to study for the NCLEX as a nursing student. In this video, we will share the top strategies nursing students are using to study and prepare for the NCLEX RN exam. Before we begin, don't forget to like and subscribe to our channel. You will be given up to 6 hours to complete the entire NCLEX exam. This includes taking 2 short breaks if you choose or want to skip. Something to note about this exam: you will not be able to skip questions and return to them. You have to answer a question in order to move on to the next one. This means you need to practice and strategize your test-taking skills in order to find the best possible answer even when you aren't really sure about the question. Which subjects are covered on the NCLEX RN exam? The NCLEX exam will have anywhere between 75 and 265 exam questions. Here is a percentage breakdown by content area of the type of questions you should see. Management of care, 17 to 23% of questions. Safety and infection control, 9 to 15% of questions. Health promotion and maintenance, 6 to 12% of questions. Psychosocial integrity, 6 to 12% of questions. Basic care and comfort, 6 to 12% of questions. Pharmacological and parenteral therapies, 12 to 18% of questions. Reduction of risk potential, 9 to 15% of questions. Physiological adaptation, 11 to 17% of questions. Here are 11 tips you can use as a nursing student to study and pass the NCLEX exam. 1. Lay out your expectations for each semester. At the beginning of each semester, sit down with a calendar and plan for it by marking dates for exams and continuous assessment dates, assignment deadlines, projects, and clinical. This way, you will have a clear picture of your expectations and commitments at one glance. 2. Identify your learning style for study. If you are a visual learner, you learn best by seeing information and visualizing the relationship between ideas. You may incorporate drawings, demonstration videos, charts, and graphs into your studies. Auditory learners prefer hearing rather than reading or seeing. If this is your style, recite information out loud and use audiobooks, videos, and discussion groups. Read-write learners study best when they make notes as they read. Tactile learners utilize hands-on skills and experimenting to learn. If this style works for you, make the skills laboratory, real patients, and case scenarios your go-to resources. Note that you do not have to stick to one style. You can interchange different learning styles for different situations. 3. Organize your notes. Organizing your notes begins with how you make them to how you store them. You can either take the notes by hand and store them in folders or binders. You can also use a personal computer to type and then save them in soft copy folders. To make the notes easily accessible when you need them, organize them in binders. Organize the notes according to your schedule, as per classes, semesters, or corresponding tests that the notes cover. Be sure to label the folders neatly for easy retrieval. You also have the alternative of getting one big folder, which you can subdivide using indexes. 4. Attend and focus on classroom material related to the NCLEX. Attending most, if not all, classes is extremely important. You should only miss a class on a rare occurrence. By not showing up for your lectures, you will be forfeiting every opportunity accorded to you to get the most essential material, to get clarifications, and ask questions about things that you do not understand. Even if you comprehend material from textbooks, the class instructor may give examples and applications that are not in any text. In addition, nursing educators tend to use discussions that make connections between different concepts. Use your textbooks and other external resources as supplements to your classwork. 5. Set a realistic NCLEX study plan schedule. With a daily study plan, you will have enough time to prepare for the main exams, which need more than 1 week of memorization. Give more time for subjects that are more challenging so that you have adequate time to absorb the information. Allow breaks so you do not lose concentration, enthusiasm, or interest. 6. Form a study group for the NCLEX exam. One significant advantage of a study group is that you can speak out loud and repeat and reinforce information, making it easy for your brain to retain and recall. Moreover, it provides a give-take learning experience where you combine your strengths, and if one group member is weak, they can always be helped by others. Form or find a group that has 2 to 3 members, and not more than 5. If you choose to study alone, pick studying places with no distractions, maintain your learning pace, and take regular breaks to remain on track. 7. Use flashcards to study questions on the NCLEX exam. Flashcards work well if you need to memorize these long lists. We have been insisting on comprehension rather than memorizing. But things like names and classes of drugs need a lot of active recall. You may use pre-made ones, flashcard applications, or make your own. Pre-made flashcards are most useful when you have a lot of content or a high number of facts to learn. When you get the opportunity, customize the cards with your words, colors, and pictures. Be smart when making flashcards by making them after each class, using mnemonics, mixing pictures and words, and creating quizzes. 8. Utilize digital learning tools to study the NCLEX. There are countless resources that you can use to actively and interactively learn, from discussion boards, chat rooms, quizzes, games, and online programs to smartphone applications. These tools are designed to help you practice the final and certification nursing exams. You may consider getting free online nursing practice exams to get a gist of what your exam questions may look like and also get confidence in answering them. 9. Practice, practice, practice. If you want to succeed in your multiple choice questions, dosage calculations, lab values, and metric conversions, then you must keep on evaluating your knowledge. However, you should only turn to practice tests after you have thoroughly studied the topics concerned. Use recognized and approved practice tests and guides meant for nursing students. Most have certification exam styles to not only help you study for internal exams, but also for licensing examinations. 10. Ask for help when needed. Do not hesitate to ask for assistance when you need it. Utilize your professor's office hours to get extra clarity and guidance on parts that you have challenges with. If your professor responds to emails, you do not have to meet them in person, and you can ask a question anytime, and they will respond when they see it. You can also turn to upperclassmen, free tutoring centers, or your classmates. 11. Get adequate rest, sleep, and eat a balanced diet. It is hard to succeed in nursing school if you are constantly sleep-deprived, fueled by coffee, and sustained by fast foods. Furthermore, you cannot take care of patients if you have not taken care of yourself. When making your study schedules, plan for time to work out, at least 3 times a week. Prepare your meals, and take some time off. If you follow all the strategies that we have discussed, you will have time for your own self-care. Let's summarize. When the exam time nears, stay calm and focus on what your instructors emphasized. Remember that a relaxed mind is likely to remember more. It is natural to be anxious about exams. They are a big deal and could be the only thing between you and your nursing career. Hopefully, you can implement a few of the NCLEX study plan ideas we have provided to do well and pass with flying colors.